An exorcist is trained to be a skeptic. Technically, I should be the last person in the room to believe that somebody is truly dealing with demonic influences. Every other possible explanation for what's taking place in the life of the person needs to be exhausted. I believe the church would cause greater harm if the church labels someone as being possessed, and that label prevents them from getting the true help that they need, either from the mental health profession or from their medical doctor.
I think I want to segue into this question, which I think would allow us to go a lot deeper into what you talked about, the rigorous vetting process that is involved in even being dispatched or being called to exorcise a allegedly demonic possessions or demonic episodes. Because I'm a psychotherapist, so I'm a social scientist by practice. So rigor and the accurate information matters. Like how the medical professions are called and all these other interconnected assessments that are required even before you do what you're going to do.
So in the United States, we follow a very strict protocol. And the number one step of the protocol would be for the person to have some type of psychiatric evaluation, either by a psychiatrist or a psychologist, basically asking these experts in the mental health field, is there something about this person's condition that is outside of your scope or understanding? Now, I'm not asking the psychiatrist, do you think this person is possessed? No. I would make that determination, but again, I want the best possible information. Many people perhaps in the mental health field may not readily believe in the possibility that what somebody is dealing with is of a spiritual nature. And that's okay, because I'm not really looking for someone, to pat me on the back or reaffirm something that I might be sensing. In fact, if someone is kind of doubtful about these things, that actually proves to be very helpful. And then step 2 of the protocol would be for the person to have a physical examination by a medical doctor. Again, wanting to know, is there a possible physical cause for what this person is experiencing in their life? So again, these experts, I'm looking for them to weigh in. They have a great knowledge in the area of mental health, in physical health. I'm not a psychiatrist, I'm not a medical doctor. So I want to work together with these experts to determine, is what this person experiencing, is it of a mental health issue? Is it physical? And then I would weigh in on whether or not I truly believe it's spiritual. So again, I want to work together. I believe that it's important for a psychiatrist, psychologist, a medical doctor, and the priest to work together to come to a conclusion about what a person is truly suffering. Because again, it should be to give them the true help that they need.
So why is it so important for you, Father Vince, to be a healthy skeptic?
Because I think there's a lot of people out there that if they're suffering from maybe a physical or a mental health issue, they might self-diagnose. There's many people that by the time they contact me, and I will say, because I'm publicly known, I currently receive about 3,500 requests a year.
Oh my goodness.
From people who believe they're dealing with the demonic. So it is good to have a healthy skepticism. And the majority of these people that contact me have already self-diagnosed. Many of them believe that they're dealing with the demonic. And it can be very difficult in working with these people because they may not accept the fact that it's not something spiritual. And unfortunately, in today's world, people can find someone to validate whatever they believe is occurring in their life. I've worked with many people where it was determined that it was not of a spiritual nature, and that I encourage folks to get a psychiatrist, see a counselor, and it would even help set that up with people. But because they were convinced it was possession, they simply ignored that and then found someone who validated what they believed to be the case. And unfortunately, in those situations, I think it takes a person who is broken, and it breaks them even more.
Thank you for discovering more with us this week. If you enjoyed watching this video, check out the full-length episode at one of the windows that pops up. And as always, see you again in next week's train of Discover More. Thank you for tuning in.